of signs and symptoms of chronic kidney disease, a problem also known as kidney failure, which is when our kidneys start to malfunction, when they begin to not work as they should. First, I'd like to wish a happy Women's Day to all women watching on March 8th, 2024 at 9:30 a.m. Congratulations to women worldwide on this day. Without you, we wouldn't be who we are or where we are. Women are mothers, women are educators. So I send my hugs and kisses to all women here on this channel on International Women's Day. In this quick video, I'll tell you the warning signs that your kidneys need help. I'll also show how to protect yourself from kidney disease and chronic kidney failure. So why is this important for us to know? First, chronic kidney disease is silent. Worldwide, about 800 million people have kidney problems. Many only discover they have kidney issues when they need dialysis or a transplant. In the United States, this number is even higher. 1 in 7 people has kidney disease. In Brazil, about 10 million patients have some degree of kidney insufficiency. I'll divide this video into 2 parts. First, I'll discuss signs and symptoms of kidney disease you can see or feel. Second, and most importantly, we'll talk about prevention. What steps can you take to reduce your risk of kidney problems? So, I'm going to talk about habits and foods you should prefer in your daily life. All right, folks, go ahead and write in the chat or comments where in Brazil or the world you're watching from. I love knowing where people are watching from and following the channel. It makes me so happy when I see people from the Northeast chiming in, when I see folks from the South region, when I see people from Brazil, Africa, Mexico, Argentina, Colombia, Portugal commenting here on the channel. It's really gratifying for me. And more than that, folks, besides telling me where you are and if you have any kidney issues, please like this video. When you like this video, we help people without access to hospitals or doctors get this important public health information. People need to know the signs and symptoms of kidney failure. Once they're aware, they can seek help if it ever happens to them. So folks, please like this video to help others learn about kidney care, okay? Let's begin. What are the 10 warning signs of kidney disease? First, skin itching or pruritus. The kidneys filter toxins from our body. They have a cleansing function for our system. When kidneys fail, this function is impaired and waste builds up in the blood, causing intense itching that seems to come from within. It's common to describe it as an itch coming from deep inside. The 9th sign, actually a symptom, is food tasting metallic. So when kidneys fail, they don't filter blood properly, causing waste to build up. Urea buildup leads to uremia, altering food taste and potentially causing loss of appetite. The 8th sign is something we can measure, see, or feel. In this case, our 8th sign is bad breath. We can detect this bad breath, also caused by uremia, through our own or other senses. It's a breath that smells like fish urine or ammonia. So as I was saying, symptoms are what you feel. Headache is a symptom, nausea is a symptom, chest pain is a symptom, pain in general are symptoms, tiredness is a symptom, weakness is a symptom. These are things we can't see or measure. Now, signs we can see and measure. What's a sign? Fever is a sign, a skin rash is a sign, increased heart rate or palpitations can be signs. So that's the difference between signs and symptoms. Our 7th sign, another sign here that we can see, is swelling in the feet, legs, and face because kidneys control the balance of minerals and also electrolytes and fluids in our body. So when there's excess fluid in our blood, it's excreted in urine. If you drink too much water, kidneys will flush out the excess. But when your kidney is weak, failing, or sick, it can't remove excess fluid anymore. So what happens to this fluid? It builds up in the body, causing swelling, which we call edema. Now, it's important to note that swelling isn't just seen in kidney disease, it can also occur in heart disease. So if someone has a cardiovascular issue, they might also have a problem. They might also show swelling or edema, but in kidney disease, this swelling tends to be more in the face besides the legs. It's usually in the face and arms, while swelling or edema from heart problems tends to be more in the lower limbs, the legs. Our 6th symptom is fatigue. And why does this happen? Because kidneys not only filter blood, they're also key in producing our blood cells. The kidneys make a hormone called erythropoietin. Erythropoietin stimulates the production of red blood cells in our blood. These red blood cells transport oxygen and nutrients throughout our body. When our kidneys fail, they stop producing erythropoietin. Without it, bone marrow can't produce red blood cells, leading to anemia. Anemia causes fatigue and weakness as muscles and brain lack oxygen and nutrients. This leaves them tired and weak, okay? Our fifth symptom is shortness of breath. This occurs for two reasons. First, excess fluid buildup strains the heart and can accumulate in the lungs. The second reason is anemia due to lack of erythropoietin. A common issue is difficulty sleeping due to breathlessness or quickly losing breath while walking. They may feel like drowning, dizzy, or weak. All of these can be related to shortness of breath. Someone who says they're short of breath or gets very tired from walking a little or climbing a flight of stairs, that's dyspnea, that's shortness of breath, okay? Our fourth symptom is feeling cold even when it's warm. Chronic kidney disease patients often feel much colder, even having chills when others don't. This is also due to possible anemia associated with chronic kidney disease. The third symptom is difficulty thinking clearly. The first cause is toxin buildup in the blood because the kidneys can't filter, so waste accumulates, and these toxins prevent the brain from working properly. And the second cause is anemia itself, since the brain doesn't receive enough oxygen, which can also make it hard to concentrate, potentially causing concentration problems. The second sign and symptom, right? Nausea is a symptom, and vomiting is a sign. Toxins build up in the body, and this severe waste accumulation causes vomiting. And the first sign, folks, the first sign, which is also quite common, maybe the most common, might be one of the first things a person will notice. I'll tell you in a moment, but first I ask that you, if you're not subscribed to the channel yet, do it now. Why? You're being selfish here, aren't you? Why do I want you to subscribe? I want you to subscribe because I want to reach 1 million followers. But what will you gain in return? You'll gain information, you'll gain health, you'll gain a doctor here, a friend of yours, who'll be here to help you whenever you need, who'll answer your questions here, okay? Who'll help you live healthier, have more energy, exposure, and health. So, if you're not subscribed, click the black subscribe button below and join Dr. Joao's channel family. Don't forget to hit the notification bell to get the latest health info first. All right, folks, our first symptom today is changes in urination. The kidneys produce urine, and when they malfunction, urination patterns can change. A person might need to urinate more frequently, or their urine might become very pale. They might only pass a few drops of urine, or they might stop urinating altogether. Waking up multiple times at night to pee could also occur. This could indicate a heart problem, prostate issues, or a urinary tract infection. The urine can become foamy, which indicates the presence of protein, specifically proteins in the urine. This means your kidneys aren't filtering proteins properly, showing they're not functioning well. Darker urine or blood in urine can indicate chronic kidney disease. Remember, you don't need all symptoms to suspect kidney disease. This video isn't over. Part 2 will show how to protect your kidneys. Let's continue. You don't need all symptoms to suspect the disease. If you have 4 of these 10 signs, you should see a doctor. The sooner you start treatment, the earlier you diagnose and address the problem, the less likely it'll develop into something serious. As we've discussed, your lifestyle choices and daily decisions are extremely important for your kidney health. What did we cover? What causes kidney disease? High blood pressure, diabetes, obesity, inactivity, all directly linked to your daily choices. It's about your diet, weight, smoking habits, drinking, and physical activity. The best way to protect your kidneys from chronic disease is a healthy lifestyle. Eat well, stay fit, sleep well, manage stress and anxiety, avoid alcohol and smoking, exercise, all crucial for kidney health. I'll teach you how to adopt this lifestyle, how to put these healthy habits into practice, which will help your kidneys and also control blood pressure, diabetes, cholesterol, anxiety, insomnia, all without medication, tests, or doctor visits. So the information in this book, The Longevity Code, 100 Habits to Live Past. 100, a book I authored. The information it contains has the potential to transform your life for the better, giving you more energy, vitality, better sleep, improved eating habits, less blood pressure medication, less diabetes medication. All of this is possible if you put these guidelines into practice. So here's what to do. Click the first link in the description or the pinned comment to get your digital longevity code, currently the only version available. When you click there or on the pinned comment link or the first description link, you'll access a discount. Dr. Joao, I'm afraid to buy the book, dislike it, and waste my money. What do you say to that? I tell you not to worry about it. And here's why. If you don't like the book, I'll refund your money. So you have an unconditional satisfaction guarantee.